Hello, my name is Sandra Moll. I'm an occupational therapist and associate professor at McMaster University, and I'm the principal investigator for the PeerOnCall project, which is stream 2 of advancing approaches to peer support for the public safety community.
Hi, my name is Nadine Leduc, and I am a project manager and research assistant at Memorial University. And I work with Sandra on this, but specifically on the emergency communicators stream of the peer support app.
The vision, I guess, for stream 2 project is really to build, co-design, deploy, and evaluate a new PeerOnCall app, which is a peer-to-peer support app for the public safety community in Canada. The focus is on 4 sectors. So the first being corrections, firefighters, paramedics, and public safety communicators.
What is often unknown for the communicator population is that secondary trauma can be even more impactful than seeing the event as the uniformed responders do. So without that understanding of the impact of secondary trauma, a lot of organizations, through no fault of their own, aren't necessarily prioritizing communicators, whereas they should be, not only because of the impacts, but also because a lot of these communication centers are small, relatively, they have a small number of staff. And oftentimes these organizations don't have the funds to provide mental health solutions. And so this app is a key resource to hundreds and hundreds of communicators across Canada.
So there's 2 interconnected apps. The first is PeerOnCall, which is for the frontline workers. And there's sort of 3 main features of the app. The first is to connect to peer support. So there's an opportunity to choose who you want to connect with and how you want to connect and when you want to connect. So you can connect by text or by phone, and there's a list of peer supporters that you can reach out to. The second feature is information. So we have, I guess, articles, videos in the app that you can, on a range of different topics. So you can filter by topics. So perhaps you're wondering, should I reach out? Am I okay? If you're having a bad call or a bad shift, if you're struggling with work to home transitions, if you're feeling numb, if you are a new recruit. So there's a number of different topics that you can filter where there'll be evidenced, informed tools or resources, tips to cope shared by peers. And then the third piece are self-management tools. So there are tools to track your wellness over time, to build action plans for change, and to build your own wellness toolbox. And there's, within the app as well, there is a gamification system where you can earn badges if you use different features of the app. So it has been a 2 or 3 year process of co-designing and co-building the app with the public safety community. So we've had series of focus groups, sprint design sessions to engage people in what it is that they wanted in terms of the features, the content of the app. And so through that process, we actually launched the app in February of this year. So we are now at the stage of implementing the app in organizations across Canada. The funding we have now is to do a 3-month implementation trial of the app in organizations. So we have about 20 to 30 organizations that we're going to implement the app with their peer support provider. So as part of the 3-month implementation trial, what we do first is we meet with organizational leaders, talk a little bit about the program and the intervention. Then we do interviews with organizational champions to start to understand the organizational culture, the communication strategies. And then we meet with the peer support providers to orient them to the app and Once they're comfortable with the technology, then we work with frontline workers. And so in terms of data collection, there's a number of different points of data collection, so we can start to track app utilization within the organization over the 3 months. So, what are people looking at what time? When did they reach out for peer support? We can start to look at the post-action reports that the peer supporters fill out in terms of the kinds of support that they're providing, the feedback that we're getting from the people who received peer support. And then we'll also be interviewing the peer support providers after a 3-month period about their experience and things that have worked and not worked within the organization. So starting to understand organization implementation and then impact of the app within the organization and within individuals. So there's a pre and post survey for the app users as well. So the vision for this app is that it would be free to frontline public safety personnel. And so there is a cost of building the app that is actually done now. And so what we're doing as part of this process is really starting to track the costs of implementation. So what are the resources required from organizations, the technology, how do we sustain that over time? So a big conversation that we're going to have right now and over the next 6 months is, what is the sustainability plan? How do we scale this in a way that is sustainable and makes it easily accessible to the public safety community, which is the vision.
And for accessibility, as we mentioned earlier, is that some of these organizations are small. They do have limited budgets. And so to have a free app is necessary. Also, within providing the app, there's also peer support that's being provided, peer support training that's being provided. And so these small communities are not only benefiting from the app, which is of no cost to them, but also receiving training on peer support so that they could do it in their own centers and also support other centers in their area.
So part of this project is really building capacity for peer support within each of these sectors.